Hi, my name's Kelly. I'm a CBT therapist and psychologist, and today I wanted to talk you through maintenance cycles. So it's something that we use in CBT to show how a client is stuck in a cycle. Sometimes they're known as vicious cycles or vicious circles, but it's all pretty much the same premise. So I'm going to hopefully show you by using a whiteboard on here. So the idea with this is that we want to be able to look at, okay, so what is the client's difficulty? So for example, it could be that they feel anxious. So when they feel anxious, you really want to see, okay, so why are they feeling anxious? And you may have this information prior. So let's just work with, okay, so someone feels anxious. So what do they do when they feel anxious? Okay, so draw an arrow. It's my attempt at an arrow. So someone feels anxious, so then they decide to stay at home. And because they stay at home, then you could ask, okay, so you're staying at home because you're feeling anxious, and then what happens? So then, different kind of arrow. Then they potentially start to overthink. So you've got this kind of the first start of the cycle. So they're feeling anxious, they stay at home, they start to overthink, or potentially they start to worry about things. And then it's like, okay, so you're feeling anxious, you're staying at home, you start to overthink, and then what? Then with this, it may be that they start to overthink, and then maybe their heart rate increases, maybe avoid their phone. So you're kind of like looking at, okay, so you've got the cognitive part there of starting to overthink. You've got the behavioural of staying at home. You've got the physiological of their heart rate, and then you've got another behaviour. You could put the avoid maybe using their phone. You could put the avoiding using their other phone in another cycle, in another kind of part of this cycle, but I'm very aware I haven't got much room there. So then, okay, so they're feeling anxious, staying at home, they start to overthink, their heart rate increases, so they avoid using their phone. And then what does that do? Nothing really changes. They still feel anxious. Nothing changes. Maybe they have FOMO because they're like, obviously they're avoiding looking at the phone, but they may be kind of imagining what other people are doing. So nothing changes. Stay feeling the same. And then kind of go around to they still feel anxious. So that is a cycle where you can see how someone's feeling anxious. So in order for them to manage their anxiety, they decide to stay at home. But then when they stay at home, then they start to overthink. When they start to overthink, the heart rate increases and they avoid using their phone. But then nothing really changes and they stay feeling the same and they continue to feel anxious, and then they could potentially continue to stay at home. So with this, as I said, you just want to be able to pull out a client's difficulty, and then you can see how the cycle will go around. So that's a really basic way to look at anxiety and look at potentially what is maintaining someone's anxiety. As I said, you may have other pieces of information that almost come down like a longitudinal formulation at the top, but that is basically a brief intro into a maintenance cycle. I hope you found that helpful. If you'd like to check out some of my other videos, please have a look. And if there's anything that you would like me to do, please drop that in the comments. Thank you.